Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And this happens to be, June happens to be Pride Month, Pride Awareness Month. And because of my medical background, I decided to make a video out of understanding LGBTQ plus and cardiovascular disease. After all, cardiovascular disease is the number one cause of death in the United States. So let's go and get started. So why is CVD a major concern for LGBTQ plus individuals? So one is that they are experiencing more cardiovascular disease due to some of the pathophysiology that comes out from discrimination. So that's one. Some of the social stressors, they're available, for instance, stigma, and being ridiculed sometimes. Discrimination, as I already mentioned, is something that is, and microaggressions are something that is especially important to understand. And then barriers to care. A lot of times there might be a gap between patient physician communication due to the sexual orientation of the patient or individual. So here's a very complex pathway, and some of it is not visible. But when you have a lot of stress, like LGBTQ plus may have, then there's a stress response pathway of that takes place. So here's stress, and then so as a result, there is a physiological change in the body from stress. So the limbic system gets activated, and the hippocampus and amygdala get activated. And these are very important parts of the brain because a lot of times this allows for memory to take place in amygdala. And amygdala actually, hippocampus is where memory is. Amygdala is more of the primal sort of rage and emotions that are available. And when you're really messing with the amygdala, there's a lot of components that are being activated, negative components. So stress kind of mediates or activates this difficult sort of system and within the brain. And then, of course, we're looking at for the pituitary gland and the hypothalamus. Hypothalamus is above the pituitary gland. So the hypothalamus is kind of also the driver of many hormones within the body. So the pituitary gland actually activates the adrenal cortex and increases release of cortisol. Anyway, so I don't want to go too much, but this is the hypothalamus pituitary axis. So it is going and activating the adrenal glands. So the adrenal medulla is something where someplace that a lot of cortisol and a lot of this is activated and works together. So this is the activation of the sympathetic nervous system, and this is causing physiological changes. So here's stress and here's physiological changes. So just to take a look at, just to recap and provide a couple more diagrams here to make sure that the physiology is understood of why cardiovascular disease is more prevalent among individuals that are of sexual minority status. So chronic stress, as I already showed in that diagram, raises inflammation, blood pressure, and cortisol. Healthcare discrimination leads to delayed diagnosis and untreated risk factors. Socioeconomic barriers increases exposure to unhealthy environments and stress. So this is something that can apply not only to cardiovascular disease, but a lot of different disorders that may take place among sexual minority individuals. So socioeconomic barriers I already went over, underscreening, missed opportunities for prevention. So a lot of times when blood pressure, if that's not taken regularly, then the individual might be might not catch high blood pressure or heart disease before it becomes very difficult to manage. And then something that is important to note is family rejection, concealment, violence, all these things are more social factors that are um, leading to stressors. And then just to recap on the mechanism, the adrenaline surge that causes faster, higher rate, higher blood pressure, increased oxygen demand, cortisol overload, higher blood sugar, inflammation, fat accumulation, immune disruption, inflammation that contributes to artery damage, sleep disruption, poor sleep increases hypertension and metabolic risk, and then finally behavioral changes like smoking, alcohol, inactivity, so that causes higher risk of heart disease. So in summary, these are some of the components that are causing causing mechanistic changes within the body, which leads to cardiovascular disease. Of course, sometimes the risk factors are not assessed properly, and so that leads to cardiovascular disease. And then discrimination and microaggressions, which lead to a lot of these stress hormones and things like that to emerge. So that's all for today. I hope this has made some sense. Thank you for listening.